Hello guys, how are you? Welcome to our channel Last Minute Pharma. Today we are going to discuss about the classification of cholinergic drug. In the previous lecture, we have started a new series of autonomic nervous system. Okay, we have already finished what is about, we have given you a basic understanding about what is this autonomic nervous system and the drugs related to autonomic nervous system in a very short and a brief manner. Then we also discussed about the cholinergic transition, like what are the transmission is happening, right? The cholinergic, like for cholinergic, the main neurotransmitter which is there is the acetylcholine, and this is responsible for promoting the parasympathetic activity. So we have detailedly understood the differentiation between the sympathetic nervous system, parasympathetic nervous system, and how are these drugs are going to help in inhibiting and enhancing the parasympathetic and the sympathetic nervous system. Now we have started with the cholinergic. That means that we are going to promote. Okay, cholinergic drugs are those drugs which are going to promote the parasympathetic activities, and we have discussed certain list of the parasympathetic activities, right? For example, if we talk about the cardiovascular function, the overall cardiovascular function is going to come down. The force of contraction we talk about, or the ventricular contraction and the systole, all these things are going to come down. AV node activity, SA node activity is going to come down. Then if we talk about the GI secretions which is there, that is going to be enhanced. Urine is going to be enhanced, so the urine excretion which is there is going to be enhanced because of the contraction of the smooth muscles. Then we also discussed about the various receptors which are present, that is the muscarinic receptors which are having the 5 subtypes, and we also discussed about the nicotinic receptors which is there, that is the NN and the NM, that is the neuromuscular junction. Okay, today we are going to detailedly understand about the classification of the cholinergic drug and the pharmacology of acetylcholine. Okay, this is a very important topic, 100% 10 marker. Write down the classify the cholinergic drugs and write down the pharmacology of acetylcholine. 5 plus 5 10 marks is a 100% question which you will get for your RGHS examinations. Okay, so as we have discussed, I'll just give a recap of the transition or transmission of the cholinergic drugs or cholinergic system. So what is going to happen over here? Acetylcholine is going to be there. It's going to be stored in this vesicle-like structure, and then this acetylcholine is going to be released and then going to bind to the various receptors or the cholinergic receptor. As simple as that. Now, after the activity of the cholinergic system, this acetylcholine is going to break down with the help of acetylcholine esterase into acetyl and choline group, and later this choline group which is there, it's going to be reversed. We are going to classify this cholinergic drugs or cholinergic agents mainly into two types. One is your directly acting agents, other one is the indirectly acting agents. So what are these directly acting agents? These means these are going to be analogs, you can say, or the precursors of this choline or the cholinergic, or you say choline, right? Choline, like acetylcholine. Okay, so these are directly going to be entered inside the blood vessel, then will go bind to the various receptors which are present all over the body and then show its action. That's why we say directly acting cholinergic agents. Now, if we talk about indirectly acting cholinergic agents, these are going to be such drugs which are going to go and inhibit this enzyme which is called as anticholinesterase. This anticholinesterase you talk about, or if I talk about indirectly acting cholinergic agents, these agents which are there are responsible for inhibiting this enzyme which is called as acetylcholinesterase. Now, if I inhibit this acetylcholinesterase, what is going to happen? There is no breakdown of acetylcholine, so which will lead to the accumulation of acetylcholine and hence will help in enhancing the function of the cholinergic system, or will help in enhancing the parasympathetic activity. As simple as that. We are classifying into two classes: directly acting, indirectly acting. Now, if we talk about the source, from where are we getting this directly acting agents? We are mainly based on the chemical compositions. Okay, based on the chemical composition, we are mainly classifying it into choline esters, which are going to be formed of the esters, and other one which is there is going to be alkaloids. They're going to be alkaloids. So these which are there, the choline are directly acting agents based on the chemical composition. We are classifying it into choline esters, which are going to form of the esters, and other ones are going to be alkaloids. Now, the examples of choline esters, you can remember it as A, B, C. You can remember it as A, B, C. A for apple, B for ball, C for car. No, it's not like that. It is A for acetylcholine, B for butanochol, and C for carbachol. So these three drugs which are there, these will come in the classification of choline esters, which are going to form the esters. And these will get hydrolyzed. Okay, these drugs which are there, as they are esters, they will easily get hydrolyzed into your acetyl and choline. Okay, the hydrolysis of these drugs are very easy. Similarly, if we talk about alkaloid groups, in alkaloid, you are mainly going to have pilocarpine and muscarine. Okay, pilocarpine which is there, okay, it's going to help in the mydriasis. Okay, we're going to help in mydriasis. That means it's going to help in dilation. Okay, it's going to help in dilation of the eyes. That we'll discuss in detail. And I'm just telling you, they are really going to have pilocarpine, which is used in the, it's used as a mydriatic, and then later we are going to have the muscarine. Then we are going to have the muscarine. Okay, I hope it is clear till here. Now, we are going to classify, then we are going to have indirectly acting agents. These are nothing but the group of anticholinesterase. These are the group of anticholinesterase. So, what are these going to go? These are going to go and bind with this enzyme which is called as acetylcholinesterase. So, here one thing you have to understand, we are classifying it into two types. One is reversible, other one is irreversible. So, how are we classifying based on that? So, for example, if the drug is going and binding with the acetylcholinesterase, after a certain time, this drug will be released. And then this acetylcholinesterase will again show its action. So the action of this is not completely inhibited, but up to for a certain amount of time it is inhibited, and later the activity is again regained. But whereas if you use your irreversible anticholinesterase, these drugs which are there, they'll go and bind with this acetylcholinesterase completely. They will not be reversible. Even if we increase the concentration of acetylcholine, it won't be showing its action. What it will do, this drug which is there, it will go and completely bind with this acetylcholinesterase. So because of which, we don't use this in humans. The irreversible drugs which are there, or the irreversible anticholinesterase which are there, we won't use it because imagine this acetylcholine is not going to break down. So which will lead to the toxicity of acetylcholine. So when there is a toxicity of acetylcholine, what will happen? See, already we know that acetylcholine activity is what? That is going to decrease the heart rate. But imagine if the heart rate is decreased very much. What is going to happen? Obviously, it can lead to death, right? So similarly, we are not going to use this in humans. We are mainly using it as an insecticides. We are mainly going to use it as insecticides. In humans, we usually don't use this irreversible anticholinesterase drugs. Okay, then if we talk about reversible, based on again the chemical composition, we are classifying it into carbamates, alcohol and others. Okay, in carbamates, this is a very important class which you are going to have your physostigmine, neostigmine and rivastigmine. You can remember this PNR number. You have usually in your passengers training and all this when you go for train and all, you have something called as PNR number, right? So this is called as physostigmine for P, neostigmine and rivastigmine. Here we learned about ABC. Then here we learned about the PNR number. Then alcohol derivative. Now see, again I'm telling you, this has a very interesting mechanism. Okay, it is your hydrophonium. It is your hydrophonium. So it's an alcohol derivative, reversible anticholinesterase drug. Then we are going to have others that are having donepezil and tartrate. Okay. Then, if we talk about irreversible, as I told you, we're not going to use this on humans. We are mainly using it as insecticides. For example, malathion is there, parathion is there. All these are insecticides coming under organophosphates. We don't use this in humans. Okay, keep that in mind. Now, especially this nerve gases like serine, tabun, sobun, all this thing. You might be thinking some name from boys. No, it's not like that. These nerve gases which are there, they were used in the historical. If you see, they are mainly used in the chemical warfares. This nerve gases which are there, they are going to be used in the chemical warfare. So because of this, what is going to happen if nerve gases, you are going to inhale these gases, what will happen? They'll go irreversibly, they'll bind to anticholinesterase activity. So because of which, what is going to happen? There is going to be respiratory failure. It's going to cause respiratory failure and then continued with the death. Right? Because imagine continuously you are in relaxed state only. So when there is no contraction of the heart, what will happen? The blood which is there will not be able to circulate, right? But will not circulate to all the parts of the body. That will lead to respiratory failure followed by death of the organism. Okay, so I hope it is clear. Next, we are going to have the carbamates, which are going to be irreversible anticholinesterase activity. That's going to be your carboxyl and propoxyl. Okay, so these are the classification of the cholinergic drugs. Okay, so this is a very important question. They'll tell you classify. So this is what you're supposed to classify and properly you're supposed to write. Okay, yeah, examination. Okay, so next now we'll be understanding about the pharmacology of acetylcholine. So that's also a very important question. So let's try to understand about the general pharmacology of the acetylcholine. With that, we can relate with the other cholinesters. And then we'll be following it with pharmacology of your reversible and irreversible. I'll just give you a gist about what is this, how does this, what is the mechanism of action of this indirectly acting agents in a bit more detailed format. Okay, let's go ahead. Okay, so now we're going to start about the pharmacology of acetylcholine. Okay, we already discussed about the classification of cholinergic drug. and now we'll be discussing about the pharmacology or what is the pharmacology of acetylcholine, followed by pharmacology of cholinesterase in a very short way. Okay. So now here, see, generally whatever cholinergic drugs are there, let it be your cholinesters, or you talk about your reversible, irreversible, all these drugs which are there, right? Like indirectly acting. They also have similar activities. The pharmacological actions which are there, they're going to be similar. What is going to change? The mechanism of action is going to change. The duration of action is going to change. Okay. So all these things are only the changing parameters. But the pharmacological activity which is there, that's going to remain same, right? Because what are we doing? We are going to enhance the parasympathetic activity. See, again, I'm focusing on enhancing the sympathetic activity, because you have to understand, okay, instead of like bugging up the pharmacological action, you're supposed to understand what are we doing this, what are we doing it for. Okay. Now, for example, if we talk about pharmacology, cholinesters, acetylcholine, methanol, carbachol is there. Simple mechanism of action is there, that these are cholinesters which are there. They are going to be binding to the muscarinic and nicotinic receptors. These are G-protein coupled receptors, and then they are going to show its pharmacological action, or then it's going to show its enhanced parasympathetic activity. Okay, let's try to list down what are the pharmacological actions, like how is it going to enhance the parasympathetic activity. Okay, so we have, see, when you exam writing, you're supposed to write in two ways. Okay, for right pharmacological action, then you are going to list down what are the muscarinic actions, and then later you are going to explain about the nicotinic actions. So now let's try to understand about the muscarinic action. The first one which is there, that's the cardiovascular parameter of the cardiovascular system. How is this drug going to affect the cardiovascular system? Now what comes in the cardiovascular system? Cardiovascular system, mainly you are going to have your heart and blood vessel. Now try to understand over here, the receptors which are present in the heart and in the blood vessels are not the same. In the heart, you are mainly going to have the M2 subtype, but whereas in the blood vessel, you're going to have the M3 subtype. So M2 is going to decrease the cyclic AMP, and M3 is going to increase the IP3 and DHA level. I hope you understood from the previous lectures when we discussed about the cholinergic receptors, right? So now here, this M2 receptors which is there, which is going to be present in the heart, when the acetylcholine binds this receptor, it is going to decrease the activity of SA node and AV node. So because of that, what is going to happen? Obviously, the heart rate which is there, okay, the heart rate which is there, that is going to come down. Now, if we talk about the blood vessel is an example of smooth muscles. And when we talk about smooth muscles, we mainly take it under M3 receptors, right? These M3 receptors which are there, they are going to increase the IP3 and DHA level. They are going to increase the IP3 and DHA level, because of which this is going to cause vasodilation. This is what is going to cause vasodilation. So I'm telling you, it's vasodilation, that means blood vessels are going to relax. Blood vessels are going to relax, and because of which the blood pressure is going to fall. Because of which the blood pressure is going to fall. So this is the effect of the acetylcholine in the cardiovascular region or the cardiovascular function. Now, if we talk next about the smooth muscles, mainly we are having the GI system, excretory system or the urinary bladder, and then you are going to have the bronchi or the lungs involved in the smooth muscles. Now, when this acetylcholine which is there goes and binds to the GI tract, smooth muscles means which receptor is there? All these are M3 type receptors. All these which are there will come under the M3 type. Please try to understand or correlate, when you are learning this pharmacological action, correlate with the receptors which are there. Okay, don't simply mug up. You have to correlate with the receptors which are there. Then you should understand where the receptors are located and how they are functioning. That's why first I have given the classification of cholinergic receptors, their locations and their actions, and then I'm going to list down the pharmacological action. It will be comparatively very easy to remember. Okay, we started with cardiovascular function and then we came to smooth muscle. So smooth muscle, you are mainly going to have the GI tract, urinary bladder and the bronchi. Okay, so when I talk about here, you can remember that bug. Okay, bronchi, urinary bladder and GI tract. Bug is going to come under smooth muscle. So now, if we talk about your GI tract, if this acetylcholine goes and binds the M3 receptors which are present in the GI tract, it is going to increase the tone of the muscle. Okay, it's going to enhance the tone of muscle, which means it is going to enhance the peristaltic movement. It's going to enhance the peristaltic movement, and because of increase in the peristaltic movement, it can lead to defecation. And one more thing is that it is going to increase the GI secretion. It is going to increase the GI secretion. That's why we said, right, parasympathetic activity less than digest. So if peristalsis is increased and the GI secretions are increased, that means digestion is going to happen well, right? Well, digestion is going to happen. Next, if we talk about the urinary bladder, This acetylcholine which is there, this is going to lead to the contraction of the detrusor muscles. Okay, is going to cause the contraction of the detrusor muscle, because of which they are having two types of muscles, right? Trigon muscle and detrusor muscles. These are the ones which are responsible for holding the urine. But when these muscles are going to relax, what is going to happen, or when these muscles are going to contract, and what is going to happen is going to promote urination. These muscles which are there, like detrusor muscles which are there, they are going to promote the urination. That is what one of the pharmacology, or that is what is one of the parasympathetic effect which we studied, right? Increase in urination. This is how it happens. Next, if we talk about the bronchi, see, majority when we discussed before, we didn't discuss much about lungs. Now, why is that so? I will explain you now here. So, mainly when this acetylcholine, it's a negative effect, okay? When this acetylcholine which is there binds to the bronchi, or binds the M3 receptors which are present in bronchi, it is going to lead to the bronchospasm. It's going to lead to the bronchospasm, that means contraction of the bronchi. So, when there's a contraction of the bronchi, and even we told it's going to increase the secretion, right? So, it's also going to increase the respiratory secretions, okay? So, when the acetylcholine which is there is going to bind to the bronchi, so it's going to cause increase in the respiratory secretion and increase in the contraction of the bronchial muscles or bronchospasm, and that is why acetylcholine which is there should not be or should be avoided to the patients who are having asthma. Okay, so asthmatic patients which are there, we should not be giving this acetylcholine, as it will enhance their episodes of getting asthma. As it will enhance their episodes, because this drug which is there, it's going to cause bronchoconstriction or bronchospasm, and plus it is going to increase the respiratory distress or respiratory secretions. Okay, so I hope it is clear. This was the effect on the smooth muscle. Now next, if I talk about, that is going to be the eye. How this is going to affect the eye? So in the eye, you are going to have the ciliary muscles and the pupils in which the M3 receptor is there. Again, the M3 receptor is responsible over here, and as I told you, M3 receptor is responsible for the smooth muscle contraction. Smooth muscle contraction. So because of which this is going to lead to the pupil contraction. So I am just correcting myself over here. Before, I think when I was explaining you about the effect on eye of this, I told mydriasis. It is not mydriasis. Please try to understand. It is not mydriasis. It is miotic effect. Okay, constriction, pupil constriction. See, I use the term. I use pupil dilation. I don't mydriasis. That is right. But then in the acetylcholine, if I talk about, it is going to lead to the pupil constriction, smooth muscle contraction. Okay, and because of which you are going to have the miotic effect. Okay, so how to remember? See, I think this is a very important 2-mark question. What is miotic? What is meiosis? Miotic. Okay, so remember always like this. For example, if I am writing mydriasis, D comes over here. D stands for dilation of the pupil. And who is going to cause the dilation of the pupil? Adrenergic drugs. Adrenergic drugs which are there, they are going to cause dilation of pupil, which will cause mydriasis. Now, the cholinergic drugs which are there, they are going to cause miotic. Okay, they are going to cause miotic effect. What does miotic effect means? See, catch C over here, constriction. This is going to cause constriction of pupil. This is going to cause constriction, you can say, or pupil contraction, you can say. This effect which is there, this is called as miotic effect. Okay, I hope it is clear till here. Now next is the exocrine gland. What is the effect of acetylcholine on exocrine gland? It's mainly going to enhance the secretion of the exocrine glands, such as your salivary glands you can talk about, or tear glands or lacrimal glands. Okay, these are going to increase the secretion of the exocrine glands. I hope it is clear. So these all are which are there. These all functions which you can see, or actions we can see. Pharmacological action. This will come under the muscarinic actions. Okay. Now, if I talk to you about the nicotinic actions, okay, majorly if you are giving in a small dose, when you are giving acetylcholine in a small dose, you will not have much nicotinic actions. Okay, nicotinic actions are negligible. These actions are only shown in the case of higher concentration of cholinergic or higher concentration of acetylcholine. So when there is a higher concentration of acetylcholine, or when they are administering this drug in a higher concentration, that time what is going to happen? This skeletal muscle twitching is going to happen, or fasciculations can be seen in the skeletal muscles. Or that's what we heard, right? Like a nicotinic action means what are you having? One is the autonomic ganglia action, other one is the neuromuscular junction actions, right? So if you come under neuromuscular junction, the major symptom or major thing you can see in higher dose of acetylcholine is that muscle twitching and fasciculations. Okay. Now, if you talk about the autonomic ganglia, what is going to happen is going to activate your both parasympathetic and sympathetic nervous system. You know the things. The autonomic ganglia which is there, in the higher concentration of acetylcholine, it is going to activate both your sympathetic nervous system also and parasympathetic nervous system also. So this condition can lead to tachycardia, which will indirectly increase the blood pressure. Is it clear? Okay, fine. So these were the pharmacological action of acetylcholine. Now, what is the ADR of it? Now, for example, what is adverse drug reaction for this particular drug? It's very simple. Now, for example, a person who is for example, if you talk about eye, if you are going for eye surgery, right? So you are giving this drug. See, these drugs which are there not specific. Okay, these drugs which are there, acetylcholine, if we talk about, it's not a specific drug that it will only go, for example, it will go only act on the salivary gland, or it will go only act on the GI gland or gastric gland. No. Once you inject or once you are going to give this cholinergic drug, it's going to act on all the other parts of the body, right? So similarly here, if you talk about the ADR, you're mainly going to have the sludge as the ADR. This you can remember it as sludge. Salivation, lacrimination, then urination, defecation, and then get GI distress and emesis. Emesis means vomiting. Okay, emesis means vomiting. So these are the major ADRs. You can remember this is a very important question. ADR of acetylcholine. Okay, and see again when I'm asking pharmacology for 5 marks, you're supposed to write mechanism of action. You're supposed to write the pharmacological action. You're supposed to write the ADR. You're supposed to write the contradiction. What are the contradictions are there? You need to write the uses and then the pharmacokinetic parameter. Okay, so here we understood that the major ADR which is over here, that's the sludge, which is nothing but salivation, lacrimination, urination, defecation, GI distress and emesis. Okay, now if we talk about the pharmacokinetic parameter, okay, now if we talk about the pharmacokinetic parameter over here of this drug, acetylcholine which is there, if you talk about the pharmacokinetic parameter, acetylcholine which is there, it is poorly absorbed. It is poorly, or it has poor oral absorption. This is going to have poor oral absorption. That's why we are going to give it intravenously. We are going to give this intravenously. Okay. Now, if we talk about its hydrolysis, see, it's going to show a rapid action. It's going to show rapid action, and it's going to have short duration action. It's going to have short duration action. Now it will have rapid action because acetylcholine is directly going to go and bind the receptors over there. But it's going to have short duration because it will undergo rapid hydrolysis. This will undergo rapid hydrolysis with the enzyme which is called as acetylcholine esterase. Acetylcholine esterase. Already we discussed about it, right? You are going to have pseudoesterase, pseudocholine esterase, then true choline esterase. So this is going to undergo rapid hydrolysis of acetylcholine esterase. And then it is mainly excreted via renal or kidney or through urine. Just drug is going to be excreted. One more thing you can note over here is that mainly if we talk about the absorption, the blood-brain barrier absorption is very less. Okay, compared to other drugs. If you compare about acetylcholine, it is not going to cross the blood-brain barrier. It's not going to cross the blood-brain barrier. So these are the certain pharmacokinetic parameters. Okay, these are certain pharmacokinetic parameters which you have to understand for acetylcholine. Okay, I hope it is clear till here. Now next we are going to have the one more contraindication. I said you that one of the major contraindications is that this drug which is there should not be given to asthmatic patients because it is going to lead to the bronchospasm and also by increasing the respiratory secretion. Okay, and the major uses, where are we going to use this drug? Mainly we are going to use it in myasthenia gravis. We are going to use in Alzheimer because Alzheimer you are going to have short memory, right? So this drug which is there is going to act on brain. This drug which is there is going to act on brain. Okay. Later, if we talk about the eye surgeries, in the eye surgeries, mainly if we talk about, it's going to have meiotic effect. Okay, it's going to have meiotic effect. So for that, in the case of eye surgeries, we are going to use this acetylcholine. So these are the drugs. Okay, these are the acetylcholine esters which are there, which are available for us, and we are going to use for this diseases. Okay, I hope it is clear. Okay, so next we'll be discussing about the pharmacology, not pharmacology, but actually I want you to see now next one which I'm going to explain, right, about the anticholinesterase. It's not important for your exam point of view, but I'll just give you just for your understanding, and then we'll wind up the today's session. Okay, I hope it is clear.